Hey guys, welcome to another edition of Ask the Doctor Lecture Series. In this week's topic, we're going to talk about concussions briefly. We're coming up on the school year and the football season and the soccer season here in Seattle, and concussions are becoming more and more of an issue as we have better recognition actually for concussions and second impact syndrome. So I want to kind of touch briefly on those two topics. So what is a concussion? I mean, concussion is the brain being bruised. And how does the brain become bruised? So remember, our skulls are a very hard object. The consistency of the brain is like a very thick jello, if you will, encased in fluid that's very thick as well. So it's, the analogy I use is it's jello in a very thick soup. And if I were to shake a pan back and forth vigorously with jello and a little bit of a thick soup that's in there, over time, if I shake it enough, that jello is going to start breaking down and you'll have little bits and pieces of jello. So use that analogy to kind of describe essentially what's happening to our brain, though we're not having a repeated trauma happening over and over again, like shaking a pan back and forth. The analogy is there to kind of describe what happens to us. So in essence, if a football player or a soccer player, a lacrosse player, cheerleaders, if they should have some sort of trauma, whether it's from a hit, a fall, and their brain gets hit, the forward motion of the skull when it hits the object causes the brain to move forward and crush into the back part of the front skull. That's called the coup. And then the brain will obviously bounce back towards the back of the skull and crush again. That's the counter coup. And what happens here is that there's bruising that happens, and that bruising is what the concussion is. There's no real fancy test that we have to kind of see the level of bruising. Our technology just isn't there yet, but we do know that once that bruising has happened, patients are going to have symptoms, especially athletes. But if you haven't lost consciousness and you kind of have, you got your bell rung, for example, you still should be removed and should be evaluated. The things that we're looking for really are, how are you responding? Do you remember the activity that you were doing before the concussion happened? Do you have memory recall of the event? Are you having double vision? Are you having ringing in your ears? Those are all kinds of things that we're constantly asking kids to kind of let us know how they're doing in their recovery state. If there's ever vomiting that happens after a traumatic event like that, that's always a worrisome sign, as well as excessive sedation. Those are always kind of indications to call 911 and get someone shipped over to the emergency room for a quick neurological study and a potential head CT to see what's going on inside of their brain. The more kind of worrisome stuff that no one really kind of highlights is second impact syndrome. And what that essentially means is that after you've had your initial injury from the concussion, if you have another injury directly right after that, your likelihood of bleeding becomes very, very high. The analogy I use here in the office is, if I had a big bruise on my arm and I went ahead and smashed that bruise again, the bruising is going to get worse and sometimes can actually cause excessive bleeding. And that's essentially what's happening inside the brain. Bleeding inside the brain can be very devastating, can ultimately lead to death, and we are still having fatality cases because of poor recognition of early concussion signs that, in my opinion, could be alleviated if we had just a knowledge base out there and training for the athletic staff, coaches, referees, etc. So after a concussion occurs, and we've had the waiting period and you've had a neurological evaluation and you've been cleared by a physician to say, okay, we think that you're doing okay, there are guidelines to return back to play. The general rule of thumb is that we want very little, physical activity or even mental activity till the symptoms go away. No headache, no nausea, people are no longer having the double vision, the ringing in the ears. We don't want any of those symptoms. That really is day zero of improvement. And from day 0 to day 7, we have a progression of increasing activity on a daily basis based on how you did the day before. So, for example, if we're at day one and we're starting to move around and do more activity and we develop a headache that day, then we are going to stay at level 1 and not progress to level 2, where we would increase the amount of exertion from a walk to a slight jog. We would stay at level 1 until you're able to do those activities and there is no symptoms that you're experiencing, and then you're allowed to progress to level 2. In a best case scenario, if we had a mild concussion, it typically takes 7 days to clear someone to go back to full participation in whatever the event is, whether it's soccer, cheerleading, or football, lacrosse, etc. So we want to be systematic about it. I think as athletes, as coaches, as parents, we want our kids to get kind of back in there and do the sports that they love. But sometimes it's better to take a step back and make sure that we're having systematic improvement, so we don't have another injury which puts someone out for the rest of the season. So I just wanted to briefly post something about concussions and second impact syndrome, especially since we are coming up in the fall season when sporting events are about to pick up for a lot of high school kids and college kids. As always, if there are any questions or comments, please leave them below. And stay tuned for our next week's edition for Ask the Doctor Lecture Series. Thanks. Have a great week.